Hello, I'm Kelly Ott,
And I'm Lara Wakefield.
and today on Focus Point, we wanted to talk to you about setting goals for your therapies and for your students or your clients.
Right? Or if you're a parent and you want to have a better understanding of goals in general and how to have conversations on how to set those and achieve those for your child. This is what we're going to talk about today.
Yeah, so someone was pointing out that we are becoming known as the IEP ladies, and we got to thinking about that, and really, goals drive the services in every setting, not just in schools.
Exactly. And this relates to whether you're in a rehabilitation hospital or a nursing home or inpatient therapies after maybe a traumatic brain injury or stroke, anything like that. We know that you're going to have goals to work on in any type of therapy or education setting.
Right. And so those goals really decide, I guess, or determine the number of minutes and the types of services that you'll be providing to your clients, whether it be in the schools or in a hospital or a nursing home or whatever setting you're in. And so it's really important that we start with looking at the main areas of need, of course, the client's strengths, and then prioritizing those goals.
Right. And for parents, I think it's really important for them to understand that no matter what setting, say, their loved one is in, whether that's a child or maybe an older young adult that they're still parenting, or even I would say as a family member with an aging relative or something. We have to understand that goals come first. You've got to set the goals first, and then goals drive the services, and then you determine how many minutes of those services you're going to need to achieve those goals. And sometimes, and maybe you can share your insight, because I know Kelly's had more experience in nursing homes than I have had, but sometimes we kind of see the opposite pattern happening where people are determining the minutes and services. Oh, they're going to get 30 minutes of speech every day. 30 minutes of PT, whatever, before they talk about the goal. They're making the decision on the minutes and the services before you talk about the goals, and that's backwards.
Yeah,
Doesn't
well,
make
we've talked
sense,
about
yeah.
in the schools were the mandates, the federal mandates that encompass the goals and what should be included in the goals. And unfortunately, in other settings, really it's about funding. I mean, it should still be about client outcomes, and that's why we're all here as therapists or educators or whatever field we're in. But ultimately, in the nursing homes and hospitals, it's about funding and the Medicare caps and insurance caps that are placed on the therapies. So yes, the goals should still drive the minutes and the amount of services that individual receives. However, there is a cap in most cases. So, it's not how we're supposed to determine what we do. We still should be looking at the client's needs and areas of strength. But realistically, when we get out into those settings, there are other factors, other mandates, so
That
to
is
speak.
true. And I like this point because in general, we do have to think about, there is only a finite set of money out there. Right. There's only so much funding for Medicaid and and Medicare, and there's only so much funding for school services. And it would be great if we could miraculously find money on some trees and make that better. But it's true. It's a finite set, and it's learning how to use those resources to the best of your ability. But yes, that is a reality factor, that funding is limited, and it does influence these services and goals for sure.
Right, and I think you hit the nail on the head. It does force us to be more efficient in what we're doing and help us prioritize. The focus really needs to be on working smarter, not harder, I guess, in some cases, and prioritizing more effectively for our clients as to what their needs are, and working collaboratively within our setting with the other disciplines, the other professionals, to help encompass all of our goals throughout that client's experience that therapy experience or educational experience, so that I'm not the only one going in working on swallowing goals in a nursing home, or I'm not the only one reinforcing speech and language in a nursing home or in a school. Everyone should be enforcing all of the goals so that the carryover and the follow through is higher.
Exactly. And I know sometimes that I had discomfort, I would say. It was outside my comfort zone, for example, to work on physical therapy transfers with a patient when I worked in rehab settings. I was worried I was going to do something wrong, and I needed to get a little bit of training from that PT first so that I could know how to do that. But once I was trained on it and I could practice it, I knew that that would only help that patient recover faster, be able to get home and back to work faster if I was also working on those things too. And even though I was a little scared to do it, it just took a little bit of training, and I could really make our sessions where we were working on swallowing and communication better. We could get out of that wheelchair, sit at the table with everybody else, and have a motivation and a better attitude, and we just made more progress when all of us were working on those goals together.
Absolutely. So these are our thoughts today on Focus Point. Please share your thoughts and chime in when you have a chance. We look forward to hearing from you.